Okay.
Okay. All right, good afternoon. I'm Christy Kearney. I'm the Behavioral Health Director for the Indiana market at CareSource. And I'm proud and honored to be here today as a corporate sponsor and a member of the Prevent Child Abuse Advisory Committee. For those of you who are not familiar with CareSource, we're a not-for-profit managed care entity. We were started by a social worker and in 1989. And we offer an Indiana, Healthy Indiana plan, Hoosier Healthwise, for our children, our pregnant women and children, Marketplace, and our dual special needs plan. And our mission is to make a lasting difference in our members' lives by improving their health and well-being. I was asked to talk today about our partnership and relationship with the Villages and Prevent Child Abuse of Indiana. And we began our relationship in January of 2021. And this partnership has really afforded us the opportunity to make a real difference in the lives of children and families. Last year, we provided a grant to Prevent Child Abuse Indiana to support prevention, which prevention is the key. We all know that, primary prevention. And we supported some trainings. We participated in the Matt Bremen Run. We've also participated in the Child Abuse Prevention Kickoff for the last couple of years. So throughout my career as a social worker, I'm a licensed social worker. I've witnessed firsthand and personally child abuse and neglect and how it impacts children and how it impacts them for the rest of their lives. Sorry. Maltreatment of any type can cause long-term physical consequences and poor mental and emotional health. And that's why I value all the work that we do here. I work for a company that believes in making a difference in the community and the lives of the people that we serve. I wanted to become more involved with a partner who provides evidence-based programming and resources that target underserved populations and to enhance the quality of life for children and families. The Villages and Prevent Child Abuse Indiana put kids first. I believe our mission at CareSource aligns with theirs and is a perfect fit with the work that's being done with children and families. We've been front and center with the Villages and Prevent Child Abuse Indiana to support programs and activities to prevent child maltreatment. Having worked in public health for 20 years, I think of child abuse in the same way I think about public health. The best way to stop it is to prevent it from happening in the first place. It starts with us and it starts with the community. Child Abuse Prevention Month is a great opportunity for us all to play a role in supporting our parents and our families. So let's take the initiative today. Let's start with us in the community and let's try to make a difference. Next, I'm excited to introduce Jeff Whitman. He is the new director of Prevent Child Abuse Indiana. And Jeff's going to come and share some of the activities that our councils across the state are doing to support prevention efforts. So welcome, Jeff.
Well, thanks everyone for being here. I appreciate it. And I'm sorry we had to plant the pinwheels yesterday with the rain and the forecast. It was looking like the best option. So, but thank you for prioritizing and meeting us here today. It sounds kind of funny, but I wish we didn't have to gather for an occasion like this. And that would mean that child abuse wasn't an issue. But unfortunately, we know that it is. And as a lifelong kind of social worker, social service member, I heard early on this idea that we want to work ourselves out of a job. And we haven't yet done that with child abuse prevention. So there's work to be done. And that's why we have National Child Abuse Prevention Month. And again, we wish we didn't have to do it, but here we are. So it gives us a platform every year to talk about the work that still needs to be done. And one of the things that we want to do while we're talking about that is kind of understand what goes into that. So in Indiana, in 2023, the Indiana Youth Institute, they put out their data book. It says that Indiana was 28th in the country for rates of child maltreatment. And is that good enough? Is anyone here satisfied with being 28?
No.
I agree with you. I certainly am not. That's up though from the previous 3 years when it was 29. So yes, we're seeing improvement, but we have a long way to go. As long as any children are hurt due to maltreatment, we have work to do. So that's why we're here. Now, on a more positive note, and I want to talk about our pinwheels. Our pinwheels are a symbol of prevention, and they're a symbol in a positive way because we wanted to represent a carefree, joyful, whimsical childhood, free from abuse and neglect. And so we want to focus, that's what we want. We want all the things that go into the work we do to result in a childhood like that. It's the childhood we want for every child. And the other thing you want to do is, some people know about the term protective factors, those things that are in communities and in and around families as support. The cyclical nature of love and support that a family provides for the child. Any parents here of adults? All right, we know that our job as parent is never done. And they're adults, they ask different questions, and sometimes they can even ask more of us. So parenting is a lifelong endeavor. But we want our kids to be happy, healthy, and carefree as much as possible. So as a nation, I want to say, and this is a little bit of a bummer too, we focus a lot downstream. And Christy said we want to prevent things, but we've gotten really good at treating the symptoms that pop up. That which emerges is what that gets our attention. And so that's kind of a downstream approach. Wait till it happens, then deal with it, and then move on. And unfortunately, that just treats symptoms. It doesn't treat root causes, and prevention treats symptoms. And so, is anyone familiar with ACEs, the adverse childhood experiences? I see some heads, nodding. ACEs are an important part of understanding what trauma does to people. But Dr. Merrick from Prevent Child Abuse Prevent Child Abuse America, she's the executive director. She gave an interesting twist on ACEs. She said, compared to she said, conditions of an adverse community and an environment are responsible for child abuse and neglect. So it's not just experiencing traumatic situations, it's our conditions in our communities are right for us to reap, childhood adversity. And so we have to change that. We can't continue to do the same thing that we've always done. And if we look back to our recent history, we can understand that what we've been through the COVID pandemic, we've been through economic hardship more recently, those kind of things impact families and negatively impact. So we want to start to realize we have to do things differently. We have to understand if we're going to impact child abuse and neglect, we have to prevent it, and we have to understand there are things in our community that are causing us to have to deal with these things. So now a little bit more positive spin on this. We got to take action. And so similar to the way that a pinwheel doesn't move unless there's wind to provide it, we can be the wind. We can provide the constant spinning and understand that it doesn't happen by itself. It takes effort and it takes action. Prevention only happens in partnership. That was a phrase that Dr. Merrick mentioned, and I thought it was a great phrase. And Prevent Child Abuse America has a theme every year for Prevent Child Abuse, National Prevent Child Abuse Month. And this year the theme is building together prevention and partnerships. And I thought it was a great way to bring together this idea that we all have a part to play. We can all do something. And so when we talk about partnerships, we're talking about partnerships with families. And so this isn't work we do to them. This is work we do with them. And with that, we do work with children and we expose them to good concepts and ideas. One thing we all can do today, adult children or not, is go back and make sure all of our kids know there needs to be a safe adult in their life. And if we can't be that person, and that's okay. Not every parent can have the relationship with their kid where they can always be the safe adult. But if that's the case, then identify somebody else who can be a safe adult that they always can go to and always talk about difficult situations in their life. And then our community partners. This gathering today is an example of the partnerships that we have. By working together, we're going to make more of a difference together. So thank you for being here. Thanks for being stakeholders and community partners with us in this work. One thing you'll see more in a few minutes when Shannon presents is the effort that the villages have prioritized this year, especially in promoting child abuse prevention. And you'll see some of the cool things that have gone on. There's been a little competition that we put together and really engaging people. Again, the idea of being in partnership and doing this work. I want to introduce some of the people that get to work or that do work on the team of Prevent Child Abuse Indiana. We get to do the work of prevention. We get to do it year round, which is kind of cool. So let's see, Kathy King. Kathy in front is our program support specialist.
You stand behind.
I'm so sorry.
Thank you.
And then behind Kathy, our newest member, Kawana Rogers. Kawana works with our prevention councils. And then next to Kawana, we have Brian Carter. Brian is a prevention education specialist. Brian works with Dad's Inc. And then Carol Poole. There's Carol in the back right here. Carol is a prevention education specialist and does work with nurturing colleagues, nurturing parents, things like that. Also works in the prisons, as does Brian, educating men in the prisons. So thank you for that and all that you do. And then our board members, we have an advisory committee, but we also have a Kids First Trust Fund board. And I know at least Doug Weinberg, you raise your hand, and Candace Shelton. Thank you for how you support the work that you do. Okay, so other things that we can do to raise awareness of what we're doing is we are planting pinwheels. We are talking about it, talking with other adults, talking with children, talking in schools. We're distributing information, and as you walk in past the front counter, we have flyers about different education courses that we offer through Prevent Child Abuse Indiana. We want to equip people with the knowledge and information to make a difference and to change habits and cycles that are in place. We provide training such as like Safe Talks, nurturing parents, nurturing fathers. We do stewards of children training in schools. We child safety matters and teen safety matters from Monique Burrow. Or other kinds of trainings that we offer. So I encourage you to go to the PCAIN website, which is pcain.org, so PCAIN.org. And on that website, under education and training, you can find a list of all the trainings we offer. And one of those flyers out in front, you can grab one of those, take those with you. Those are a list of trainings. You can call us, or you can go on our website and you can request those trainings. That's something else we can do. And then we wanted to continue to build the community support and for prevention. Now, Department of Child Services, we most often know them for doing and intervening in people's lives when there are problems. However, a huge part of what Department of Child Services does is focused around prevention. In fact, we've got one of their members from their prevention team, Willie Taylor, is here. Thank you, Willie. And that's something that people don't realize DCS does. They put a lot of time and energy into preventing kids having to come into our system, and we are grateful for that partnership. Thank you. And one of the things that I want to share with you is our website here. On our website, you can go to a tab called Find Your Counsel, and we have child abuse prevention councils all across Indiana. Every county, all 92 that you see, the ones that have a pinwheel on this map on our website, those are where we have prevention councils. And those are people that have the local pulse and voice of what's going on in their county. What does child abuse and neglect look like in our county? How does it manifest itself? And they are the grassroots effort of the voice of prevention in those counties. We don't have every county covered, as you can see on there. And so we would like all 92, every county in Indiana to have the representation of a child abuse prevention council. And so if you live in any of those counties, or you know someone in those counties where there's not a council, let us know. Let us know how we can help. And then lastly, I want to talk about Indiana has the first time ever a statewide child abuse and neglect framework. And that was put together, 5-year effort that culminated in 2022. And it's a way for us all to come together to understand we can do this together. We all can do something, play a part. So the framework is a systematic way. It's kind of a strategic plan. I've heard Shannon say, we're bringing a wider net of participation into the conversation of prevention. And we are piloting that in 8 counties this year. We're piloting 8 more next year. and it's available on the DCS website. Anybody that wants it can get it. There's a 41-page toolkit that's associated with it, which is a great resource. I would invite anybody to be part of helping us prevent child abuse and neglect. It's the action that we need to make the pinwheel spin. So with that, I want to introduce Shannon Schumacher, who is the CEO of The Villages. Okay.
Thank you so much, Jeff, and thank you so much, Christy from CareSource. I mean, we couldn't do it without our partners and without CareSource. They're such a vital partner to all of our work. And I want to give another kudos out to our PCAIN, our Prevent Child Abuse Indiana team, Kathy and Brian and Nancy and Kawana and Carol back there. I mean, just incredible work that they do every single day to help alleviate child abuse across the state, and just an amazing team of individuals. And our council, we have a Prevent Child Abuse Indiana Council that is very, very active in helping us do the great work that we do. I do want to give a call out, a shout out to our team that helped this whole thing happen. So Krista and Kathy and the two Beths, we have two Beths here. And Ray, our IT guy, who could not do anything. We should never do anything. Take care, frankly. So thank you, Ray, for coming from Bloomington. So I also want to talk about the Villages and the work that we do. So I am privileged and honored to be the CEO and of the Villages of Indiana and the Executive Director of Prevent Child Abuse Indiana. And we have over 300 staff and volunteer leaders across the state, 17 sites across the state that work hard every day to bring passion to helping children not be victims of abuse and neglect. And the one thing that I have to say about every single one of those 300 people is that their main focus every single day that they wake up, and that is to prevent child maltreatment. And so you might be asking, what are some of the things that are going on out there in the Villages land? Well, we have this very friendly competition right now that our teams out there are trying to be the most creative about how they are going to demonstrate what Child Abuse Prevention Month is like. So I want to share some of the entries with you. So they've done things like blue. Blue is our color, as you've probably noticed, for Child Abuse Prevention Month. And so let's see some of our wonderful entries. These are some of our Fort Wayne people. Some Healthy Families people from Bloomington. I love the antenna. Okay, so we love children, but we also love your parents. So much so that, yeah, so we even have we've added a bereavement option for our staff if they lose a pet. We love pets so much. So very, very important to what we do and to our children. Okay, so yeah, look at I love the pajamas there. Yeah, it's our foster care team in Indianapolis. So this is our kinship care group. So we have kin providers who take care of children who aren't their own, mostly grandchildren and nieces and nephews. So this is their support group. Okay, so here's some blue. So Debbie, our lead accountant, actually she dyed her hair blue. Some blue suede shoes, some pretty toes.
Yay! Healthy families.
Shout out to Healthy Families. This one is a techie one, so this one we feel really proud about how the admissions team. Another Fort Wayne group. Fort Wayne's very active in this competition. They're very competitive up there. Okay, so here we have a
Healthy family behavior.
That's Decatur County, my home county.
What happened? Here we go. Sorry about that.
Yay. Well, thanks to all of our team for their creativity, one creative group, as you can see. And so we're gonna announce the winner. So the winner is actually this group. That's our finance team. So they have so much energy and fun, and they're in Bloomington, and they will get a pizza party out of this. So yay, shout out to them. So now you may be asking, so I don't work for the villages and I don't volunteer for the villages. Hopefully you will someday. But so what can I do? You might be asking, what can I do to help prevent child abuse? Well, I would say the very first thing to do is to try to educate yourself on what is child abuse, what is child abuse and neglect, and what are the effective ways that we can address it. And I think things have changed. So keeping up with this is very, very important. And I would suggest that you go to our website, the PCAIN.org website, and Prevent Child Abuse America has lots and lots of data about what is child abuse and what is it that we can do that is proven to help alleviate it. And I will say, so we're part of the Prevent Child Abuse America network, and we've been around for 50 years. So PCAA is what they're called, have been around for 50 years, and they have invested lots and lots of time and resources to research, to have rigorous research and evaluation about what does work. And we have learned a lot. So I'll tell you about some of the things that we have learned. So one of the things that we know is that parental overload and stress are important factors that we're going to have to address. We know this. We absolutely 100% know that parental overload is something that has to be interwoven in everything that we do, addressing that. Another thing that we know is that affordable childcare, home visitation programs, like our Healthy Families program that supports families with newborns. There's nothing more overloading on a parent than a newborn in the home. And any of you who've ever had one know this is true. And also access to mental health care are proven ways to help with prevention. Proven ways, we know this. We also know that prevention efforts are always, I want to say always, under-resourced. They're always under-resourced. And we all know that prevention will keep us from getting to the end result of abuse. And we also know that an ounce of prevention is worth a pound of cure. We know that's true, but the funding doesn't follow that pattern. It's usually the squeaky wheel that gets the attention. And so very, very important that we know that we have to have more resources if we're going to make an impact. Okay, so that's what we know. So then you're probably asking, well, what can I do? What can I do? Well, one of the things you can do is you can advocate for policies and programs that support families. Advocate, and so you might be thinking, how do I advocate? Well, I can tell you right now that the state legislature right now has bills that they're looking at that have to do with child care access, that have to do with mental health care access, that people can access mental health care. We know that they're working on expanding home visitation services for pregnant women and families with newborns. Super, super important. You all have a legislature. I know it sounds like, ooh, what do we do? How do I contact? They are so open and want to hear from you, and you can really make a difference by reaching out to your legislator. Another thing you can do is you can purchase pinwheels and display them at your home and in your office or where you work. And here's some of the information on that. So as we've talked about, I think Jeff did a great job of explaining the pinwheel. And so I think one of the big pieces you can do if you plant one of these gardens or plant pinwheels, people ask questions. What is that? What's that for? And it's always an opening for you to talk about exactly what it is. And I say, one of my big goals in life is that we won't have to explain what this pinwheel is. That we will never have to explain it, that people will see it and they'll know it and they will understand. Another thing that you can do is purchase Kids First license plate. Does anybody know what those are? The little handprints. And, you know, when they first started the vanity license plates, the Kids First was one of the very first. And at that time, they generated lots of revenue from primary prevention. So all the proceeds, if you get one of those license plates, all of those proceeds go to primary prevention, which is about the only source of income and funding that we have, honestly. So real easy, you can just, I mean, now there's like 50,000 different license plates, but go to the Kids First license plate next time that you renew your license, and that will go to directly to prevention efforts. Hugely important. I can't stress that enough. So anytime you see somebody dropping on one of those thumbs up. Okay. Another thing that you can do is you can attend our Matt Bremen 5K run, which is coming up April 22nd to raise awareness. Plus you can get your steps in. You can bring your dog can walk with you. You know, we're dog people here. So, so I think that's an important thing that you can do. You can volunteer in your community for one of the prevention councils. And that's a really great way to understand what's happening in local communities and how to address issues grassroots. So wonderful opportunity there. And lastly, I would just like to say, when I think about what else you can do, and simply by offering support and a helping hand and a kind word or two when you see a parent struggle. Now, I know you see parents struggle all the time. You see it in the grocery store, see it on airplanes, see it in church, you see it in your neighborhood. And those are the times where you can actually make a huge difference in a person's life. I mean, I still remember the stranger who returned my shopping cart and gave me kind words during a rainstorm 15 years ago when I was trying to get my hysterical infant into the car seat. And I will not, I mean, 15 years later, I remember that person, and I remember her words of, you know, this is going to go real fast. This little guy is going to be grown real soon. And I just thought, yes, that's right. And so there are all kinds of little things that you can do when you see a parent that is struggling. And that was just one of the times I was in that parental overload through my parenting of a small child. So I will say Mother Nature, I know as Jeff talked about, kind of interrupted our planting of our pinwheel garden today. But so we have already planted our pinwheel garden. If you've seen it, there's us yesterday. Weather was much better yesterday here. So yes, there's over 1,000 pinwheels there, and we're right on Meridian Street. So this is a wonderful opportunity for people to say, "Oh, what is that? What's going on there? What's this?" So yes, so if you have an opportunity to go see that, and I would just say, thank you so much for taking the time out of your day and coming here and helping us kick off Child Abuse Prevention Month. It's just so important. And I thank you again, because I know you're here because you care deeply about the well-being of children. So thank you. Oh, we're going out there. I mean, cookies and